patient gets hip pathology, sometimes one of the major problems is stiffness and a change in the quality of the movement, so-called movement dysfunction. And we can eliminate some of the pain by using a distraction technique to the hip joint to start with, and then we'll look at 2 further techniques that we can use to try to use the new movement that we have to redress the imbalance which can lead to the movement dysfunction. So where the patient comes in saying that their hip pain is worse with prolonged standing or prolonged walking, that normally indicates an inflammatory response through compression. So if we can do the reverse movement, which would be traction, we can often modify those symptoms, and in the time when the pain is lessened, we can then do more manual therapy techniques. So I'm going to be placing traction on the leg, but obviously the leg and the hip joint is a large object, so I need to make sure I'm not putting too much stress on my own body. So I could, for example, simply take hold of the model's foot and lean back, but that's going to place stress onto my hands. It's going to be uncomfortable for her, and it's also going to be imparting the force at quite a distance to the target, which is the hip joint. So instead, I'm going to use a triple grip onto the leg. So I've got the leg high up under my axilla. So the first grip is to use my arm coming round. So I'm gripping into the side. The second grip is the hand, and the third grip is coming here. Now I'm not using my fingertips, I'm using the flat surface of my hand. And I can come further in, so I'm getting closer up to the hip, or I can come further back. So I'm in an open pack position, so that's one of flexion and abduction and external rotation. And remember, the open pack position is where the joint structures are more relaxed. I'm coming into a stance position, and all I'm doing is leaning backwards. Now inevitably, as I do this, I will get some lateral tilt of the pelvis, but I'm going to impart a small amount of distraction onto that hip joint. And what we're looking for is for the patient's symptoms to be modified. So if she had a dull ache, we try to reduce that. Now I can vary the grip. If I want to have less hand grip, then I can come into a forelock. So I come into this position. Now there's more stress placed onto my forearm as it presses into the back of her calf. So it can vary the movement itself, and we can also use a traction belt into that movement as well.